Time for StudyBuddy review. I will be reviewing the topic with you by asking you questions with pauses in between. It's like a virtual StudyBuddy and flashcards for your ears. Okay, let's begin. Corticosteroids. What are corticosteroids? Corticosteroids are synthetic steroid hormones made to mimic natural steroid hormones produced by the body. Do you remember where steroids are produced in the body? That's right. Steroids are made by the adrenal cortex, which is located where? Yes, on top of each kidney. That's why it gets the name adrenal. And remember, we went over in the lecture video that corticosteroids are man-made steroids while glucocorticoids are natural steroids made by the body. So what is the most well-known example of glucocorticoid? Correct. Cortisol is a steroid hormone that plays an important role in stress response. Alright, let's go back to corticosteroid, which is the synthetic form of steroid. What are corticosteroids used for? Think of the functions of steroids in the body? Yes, you are definitely correct if you mentioned adrenal insufficiency or Addison's disease, in which the adrenal glands don't make enough cortisol. Cortisol plays an important role in glucose, fat, and protein metabolism, and it is also important in stress response and has anti-inflammatory and immune suppressive properties. That's why steroids are used as an immunosuppressant to prevent rejection in organ transplant and to reduce inflammation in autoimmune disorders such as rheumatoid arthritis and osteoporosis. Okay, let's move on to the side effects of steroids, which are heavily tested on the NCLEX. So because of its immunosuppressive property, what should you monitor for as a nurse? Yes, you want to monitor for signs and symptoms of infection such as fever and sore throat. That's why steroids are contraindicated in those with active infection. What other side effects can you think of? What about the blood sugar level? How do steroids affect glucose level? Yes, steroids increase blood glucose level, especially in those with diabetes. So monitor glucose level closely in diabetic patients and adjust insulin regimen as needed. Steroid can also cause swelling or edema because it retains water and sodium. How should patients monitor for increased swelling at home? What should you teach them as a nurse? Yes, educate patients to check their weight daily, at the same time every day, and report if there is rapid weight gain, such as gaining 1 pound in one day or 2 to 3 pounds in a few days. Remember this for NCLEX: 1 pound in one day or 2 to 3 pounds in a few days. Alright, how should steroids be taken? On an empty stomach or with food? Yes, steroids should always be taken with food because it can cause what in the stomach? Yes, steroids can cause gastric or peptic ulcers, which put patients at a higher risk of GI bleed. What is the other class of medication that reduces pain but also has a high risk of GI bleed? Yes, NSAIDs such as aspirin or ibuprofen. So avoid them while on steroids. Alright, what about long-term side effects? What can you think of? Yes, long-term use of steroids can cause osteoporosis and cataract, so educate patients to take vitamin D and calcium supplements and get routine eye exams. Okay, that sums up the side effects. Let's finish the review with when to adjust steroid doses. So tell me, when do steroid doses need to be adjusted? That's right, steroid doses need to be increased during times of stress, infection, or before any major surgeries, and if steroids need to be stopped, it should be tapered off slowly. Never abruptly discontinue steroids. Remember this for NCLEX. Abrupt discontinuation of steroids can lead to Addisonian crisis, which is a life-threatening condition due to severe cortisol and aldosterone insufficiency. You did a great job. Like and comment if you want to see more StudyBuddy series. See you next time.